Welcome, everyone, to our live trivia showdown. Get ready to test your knowledge, sharpen your reflexes, and dive deep into the fascinating world of ophthalmology. Whether you're a seasoned eye care professional or just love learning about the human eye, this is your chance to shine. Today's trivia is all about the science of sight. We'll explore everything from glaucoma treatments like SLT and trabeculectomy to retinal conditions such as retinopathy of prematurity and lattice degeneration. You'll encounter questions on corneal diseases, cataract surgery techniques like phacoemulsification, and even rare neuro-ophthalmic syndromes. And yes, we're throwing in a few curveballs from pediatric genetics and orbital disorders, because why not keep things exciting? Here's how it works. There will be 25 questions in total. Each question has 4 answer options, but only one is correct. To answer, simply comment the number of the correct option or type the full answer. The faster you respond, the more points you earn, so speed and accuracy both matter. So, keep your eyes wide open and your minds even sharper. Let's see who's got the vision to win it all. Remember, 25 questions, 4 choices, 1 right answer. Speed counts. Type the number or full answer. Let's begin. Here comes question 1 of 25. What is the most common complication of selective laser trabeculoplasty, SLT? 1. Transient IOP increase. 2. Synechia. 3. Pain. 4. Iritis. Think carefully and drop your answer in the chat, number or full text. SLT is a popular glaucoma treatment, quick, effective, and often well tolerated. But like any procedure, it's not without potential side effects or surprises. Keep those answers coming, speed matters, but accuracy seals the deal. Ready for more? Let's see who's got the sharpest clinical instincts tonight. SLT targets pigmented trabecular meshwork cells to improve aqueous outflow. Correct answer, transient IOP increase. 27 nailed it, great job, everyone. Shout out, Ahmad, Mohammed, Hiba, Ahmed. Here's question 2, let's keep the momentum going, glaucoma warriors. A 55-year-old man had uncomplicated trabeculectomy. On day 4, IOP is 45 mm of mercury, shallow anterior chamber, and the bleb looks elevated. What's the next best intervention? 1. Start timolol eye drops. 2. Start atropine eye drops. 3. Start acetazolamide pills. 4. Perform laser suture lysis. Think it through, timing and logic are key here. Post-op complications can be tricky, what would you do next? Submit your answers now, let's see who's thinking like a surgeon. Atropine deepens anterior chamber by relaxing ciliary muscle and pulling iris posteriorly. Correct answer, start atropine eye drops. 13 got it right, nice thinking, team. Shout out, Ahmed, Mohammed, Dr. Hassan, Ahmed. Here comes question 3, let's test your ocular anatomy knowledge. Eye syndrome affects which structure? 1. Trabecular meshwork. 2. Lens capsule. 3. Iris stroma. 4. Corneal endothelium. Take a deep breath, think pathology, not the weather. Eyes on the prize, submit your answers now. Eye syndrome often leads to secondary angle closure glaucoma in young adults. Correct answer, corneal endothelium, well done. 35 nailed it, impressive ophthalmology knowledge. Shout out, Mohammed, Ahmad, Ahmed, Dr. Shima. Question 4 coming in, let's talk corneal iron lines. Which line is linked to pterygium? 1. Stocker's line. 2. Sampalisi's line. 3. Hudson-Stahli line. 4. Ferry's line. Iron lines may be tiny, but they tell big stories, lock in answers. Stocker's line appears ahead of a pterygium due to iron deposition. Correct answer. Stocker's line. Great job. 35 of 39 answered it correctly. Shout out, Mohammed, Ahmad, Saif, Heba. Here comes question 5. Ready those diagnostic skills. Patient wakes with painful red eye. 1. Reese-Buckler's dystrophy. 2. Map-dot fingerprint dystrophy. 3. Gelatinous drop-like dystrophy. 4. Fuchs endothelial dystrophy. Corneal clues are key. Trust your instincts and submit those answers now. Map-dot fingerprint dystrophy often causes recurrent corneal erosions, especially upon waking. Correct answer, map-dot fingerprint dystrophy. 36 of 41 got it right. Well done, Saif, Muhammad, Ahmed, Shima. Question 6 is here. Keep those eyes sharp. Marginal keratitis is linked with what? 1. Adenoviral conjunctivitis. 2. Staphylococcal blepharitis. 3. Fungal infection. 4. Contact lens overwear. Think inflammation triggers. Submit your answers now, cornea detectives. Marginal keratitis often presents with peripheral corneal infiltrates near the limbus. Correct answer, staphylococcal blepharitis. Well done. All 38 players nailed it. Shout out, Mohammed, Saif, Usama, Amira. Question 7 coming in. Focus those diagnostic lenses. Well, droplet cataract is linked with what? 1. Wilson's disease. 2. Myotonic dystrophy. 3. Marfan syndrome. 4. Galactosemia. Think metabolic clues, locking your answers, future ophthalmology legends. Well, droplet cataracts often appear early in metabolic disorders like galactosemia. Correct answer, galactosemia. Great job, everyone. 30 out of 38 answered correctly. Bravo, Saif, Usama, Bilal, Mohammed. Question 8. Time to scrub in mentally. Which organism causes post-op endophthalmitis most often? 1. Staph epidermidis. 2. Staph aureus. 3. Pseudomonas aeruginosa. 4. Candida albicans. Think fast, your microbiology memory is about to shine. Staph epidermidis is part of normal skin flora, often underestimated but opportunistic. Correct answer, staph epidermidis. Nicely done, everyone. 28 of 39 answered correctly. Shout out Saif, Muhammad, Shima, Lena. Question 9. Let's keep the momentum going. What doesn't cause iris prolapse here? 1. Wound size too large. 2. Suprachoroidal hemorrhage. 3. Infusion bottle too high. 4. Excessive phaco power. Choose wisely, ophthalmic knowledge is your superpower today. Phacoemulsification uses ultrasound to break cataracts, minimally invasive and highly effective technique. Correct answer, excessive phaco power. Well done. 28 of 40 got it right. Usama, Fatma, Bishoy, Ahmed, great job. Here comes question 10, double digits already. What increases TAS risk during surgery? 1. Povidone iodine use. 2. Intracameral antibiotics. 3. Posterior capsule rupture. 4. Poor instrument flushing. Think carefully, tiny details can cause big trouble. TAS can develop within 12 to 48 hours after anterior segment surgery. Watch for inflammation. Correct answer, inadequate instrument flushing. Nice work. 32 of 39 answered correctly. Shout out, H, Hassan, Maha, Ahmed. Question 11 coming your way. Let's probe your knowledge. What does a soft stop suggest? 1. Lacrimal sac or common canaliculus obstruction. 2. Probe entering nasal cavity. 3. Nasolacrimal duct obstruction. 4. Valve of Hassner resistance. Trust your instincts. Every stop tells a story. The lacrimal system drains tears from eyes into the nasal cavity. Correct answer, lacrimal sac or canaliculus obstruction. 34 of 37 answered correctly. Well done Iman, Fatma, Lena, Usama. Here comes question 12, think syndromes, think symptoms. A 12-year-old boy presents with progressive high myopia, mild hearing loss, cleft palate, joint hypermobility. Fundus shows lattice degeneration. What's the likely diagnosis? 1. Usher syndrome. 2. Stickler syndrome. 3. Marfan syndrome. 4. Congenital rubella syndrome. Clues are in the details. Trust your clinical instincts. Stickler syndrome often includes joint issues and hearing loss in children. Correct answer, Stickler syndrome. Well done. 26 of 39 answered correctly. Shout out just_Gok, Saif, Ahmed, Muhammad. Time for question 13. Let's sparkle with knowledge. Syncus scintillans is most commonly composed of 1. Lipofuscin, 2. Cholesterol crystals, 3. Calcium phosphate, 4. Calcium oxalate. Eyes shimmering with clues, locking your answer now. Syncus scintillans often occurs after trauma or chronic eye inflammation. Rare but fascinating. Correct answer, cholesterol crystals. Nice work. 31 of 36 answered correctly. Mohammed, Ahmed, Saif, great job. Question 14 coming in. Let's keep those eyes sharp. What is the most sight-threatening complication of angioid streaks? 1. Vitreous hemorrhage, 2. Retinal detachment, 3. Optic atrophy, 4. CNV. Trust your instincts. Tap that answer now. Streak into victory. Angioid streaks are often associated with pseudoxanthoma elasticum. Rare but important link. Correct answer is CNV. Well done. 37 of 38 got it. Fatma, Mohammed, Saif, Mohammed, brilliant. Here comes question 15. Get ready, retina experts. Which is a hallmark finding in Best disease? 1. Vitelliform lesion, 2. Cherry red spot, 3. Bull's-eye maculopathy, 4. Bone spicule pigmentation. Think carefully, this one tests your macular memory. Best disease often appears in childhood with central vision changes. Rare, but important. Correct answer is vitelliform lesion. Nice. 30 out of 37 answered correctly. Saif, Mohammed, Shima, Ahmed, great job. Time for question 16. Focus your ophthalmology brainpower. Which best describes stage 3 ROP? 1. Demarcation line, 2. Total retinal detachment, 3. Ridge with extraretinal fibrovascular proliferation, 4. Ridge formation. Think fast. ROP staging can be tricky but crucial. Stage 3 ROP may require treatment to prevent retinal detachment, important stage. Correct answer, ridge with extraretinal fibrovascular proliferation. 32 players got it right, impressive. Shout out to Mohammed, Ahmed, Hassan, Amira. Here comes question 17, let's keep the momentum going strong. A glial tuft in the center of the optic disc with parapapillary pigmentation is seen in 1. Optic nerve coloboma. 2. Optic disc pit. 3. Myelinated nerve fibers. 4. Morning glory syndrome. Eyes on the prize, trust your neuro-ophthalmology instincts here. Morning glory syndrome resembles a flower, named for its striking optic disc appearance. Correct answer, morning glory syndrome. Well done. 34 players answered correctly, great job. Shout out, Usama, Mohammed, Ahmed, Saif. Question 18 coming right up. Keep those neurons firing. Pie in the sky visual field defect is classically associated with 1. Temporal lobe lesion. 2. Parietal lobe lesion. 3. Optic nerve lesion. 4. Occipital lobe lesion. Think brain anatomy, aim high and lock in your answer now. The temporal lobe helps process emotions, language, and visual memory, pretty important stuff. Correct answer, temporal lobe lesion. Impressive. 29 players nailed it, great work. Shout out, Ahmed, Mohammed, Saif, Dr. Shima. Question 19. Let's test your neuro-ophthalmology knowledge. Which drug localizes postganglionic Horner syndrome? 1. Tropicamide. 2. Pilocarpine. 3. Hydroxyamphetamine. 4. Cocaine. Think pharmacology. Choose wisely and lock in your answer now. Horner syndrome often presents with ptosis, meiosis, and facial anhidrosis, classic triad. Correct answer, hydroxyamphetamine. Nicely done, everyone. 26 got it right, great job. Shout out, Saif, Lena, Ahmed, Dr. Samaya. Question 20. Let's focus on pupil behavior in different lighting. Anisocoria worsens in dim light. Why? 1. Sympathetic pathway. 2. Parasympathetic pathway. 3. Light reflex arc. 4. Edinger-Westphal nucleus. Eyes on the prize, submit your answer now. Pupil dilation in darkness relies on an intact sympathetic nervous system pathway. Correct answer, sympathetic pathway. Well done. 14 of 35 answered correctly. Shout out, Mohammed, Saif, Mohammed, Bilal. Question 21. Let's talk eye movement patterns and muscle behavior. Superior oblique overaction is most likely in 1. V-pattern exotropia. 2. V-pattern esotropia. 3. A-pattern exotropia. 4. A-pattern esotropia. Trust your instincts. Lock in those answers now. Superior oblique muscle helps rotate the eye downward and outward diagonally. Fascinating, right? Correct answer, A-pattern exotropia. Impressive. 5 of 36 answered correctly. Kudos Ahmed, Radwa, Adam, Ahmed. Question 22. Time to test your neuro-ophthalmology knowledge. Which cranial nerve palsy most commonly causes vertical diplopia? 1. CN6. 2. CNV. 3. CN4. 4. CN3. Think carefully, vertical double vision can be tricky. Lock in those answers now. The trochlear nerve, CN4, is the smallest cranial nerve by axon count. Correct answer, CN4. Well done. 33 of 37 answered correctly. Shout out Mohammed, Shima, Hassan, Ahmed. Question 23. Let's dive into some classic oculoplastic knowledge. Blepharophimosis syndrome is characterized by all of the following except 1. Telecanthus. 2. Ptosis. 3. Epicanthus inversus. 4. Entropion. Think carefully, one of these doesn't belong. Submit your answers now, eye experts. Blepharophimosis often includes ptosis and telecanthus from birth, rare but distinct features. Correct answer, entropion. Nicely done, everyone. 21 of 37 answered correctly. Shout out H, Saif, Usama, Bishoy. Question 24. Let's test your clinical signs knowledge. Dalrymple sign is best described as 1. Twitching of eyelid on upward gaze. 2. Retraction of the upper eyelid in primary gaze. 3. Lag of the upper eyelid in downward gaze. 4. Delayed elevation of upper lid during upgaze. Choose wisely, eyelid clues can reveal a lot. Dalrymple sign is often seen in thyroid eye disease cases. Fascinating, right? Correct answer, upper lid retraction, primary gaze. 29 of 38 answered correctly. Well done Ahmed, Saif, Hassan, Lena. Final question, let's finish strong, everyone. This condition is caused by which of the following? 1. Myopathic weakness of the levator palpebrae. 2. Miswiring between the trigeminal and oculomotor nerves. 3. Congenital fibrosis of extraocular muscles. 4. Aberrant regeneration of the oculomotor nerve. Think carefully, neurological clues can be tricky but rewarding. Did you know? Oculomotor nerve issues can mimic muscle disorders, tricky diagnosis. Correct answer, trigeminal oculomotor nerve miswiring. 28 of 39 answered correctly. Great job Huggy, Mohammed, Bilal, El Nokali. And our top winner is Saif G. Whaley, 23 correct answers, outstanding performance. Also tied, Muhammad Ali Shaban with 23, brilliant effort. Huge applause to everyone, 46 players, fantastic energy. Until next time, stay curious and keep playing.